My name is Dr. Samuel Esiebu. I'm the director of Iris Optometric Practice. I also work at the Kolebu Teaching Hospital, of course. The purpose for this particular exercise is in line with a document that was proposed by WHO called Vision 2020, the Right to Sight. Basically, what this document depicts is that no person should go blind unnecessarily, especially from diseases that cause what we call reversible blindness. So, in view of that document, a policy came out, and for that matter, on the second Thursday in October, in the month of October, has been declared as World Sight Day. So it's been celebrated all over the world, Ghana and everywhere. The second reason that we are here is in line with the Sustainable Development Goals. And the goals, we are taking goal number 3 and goal number 4. Goal number 3 is universal health for everybody at all age. And goal number 4 is quality education, accessibility to quality education. And why am I saying that? If your eyes are seeing well and the health of your eye is good, then definitely when you are in class, you should be able to study well. If you're unable to see well in class, definitely it's going to affect your academic performance. So seeing well and quality education are being married into two. So as part of a corporate social responsibility, we decided to come to a public school to conduct free eye services or free screening for children who otherwise may not have the means or cannot afford to go to hospitals. So as you can see, we've already begun, and cases that those who will need glasses, we will give them glasses. It's on the cost of the company. Those who may need further examination will be referred to the appropriate hospital or the closest hospital that their parents can afford them to go. Well, we've been organizing free eye screening, but we haven't done it in the way we are organizing it like today. So we've been doing it. It's not the first time that we are doing this. Seeing well also, in a way, relate to academic performance. So, mind you, the one who is recommending or prescribing the glasses for you is a well-trained professional and wouldn't want to perjure or injure the way you see by giving you something that you don't need. So when you are being given asked to wear glasses, obviously it's something that you need to wear. So it's part of the reason why we are here, to demystify that notion that when you wear glasses, rather it impacts negatively on your sight. We want to explain to people that wearing glasses, if you need it, will rather enhance the way you see and also improve on your quality of life. Because we have people who have sight so poor that apart from you waving them, are unable to see clearly. But as soon as you give them glasses, help them to see well. So it is part of the reason why we are here, to demystify that notion, that thought, that impression that glasses doesn't help one to see well. Like I said, it's a free service that we are rendering to the children. So, I mean, for today, it's free. But it doesn't mean that it's free at Iris. When they come to Iris, you need glasses, obviously you need to pay for it. But we discussed with the school. The school actually wrote to us that they need such service from us because of the World Sight Day. We couldn't come on the said date because we had certain engagement. So we arranged with the school that we'd rather come today. So God willing and God being so kind, today we are set it up for us to be here. We have plans of giving what we call, in our own word, universal coverage. So as many schools that when they write to us formally, they write to us, well, and if we also have the means to be able to do that. Because all these things involve money. Bringing glasses, issuing glasses, especially if it comes free. So you need to have a budget. So this particular project, we budgeted for it and we are running it. So as and when we also get budget, we will do that. So in a way, we are also appealing to whoever is looking at us that if it touches that person's heart and want to support this project, that person is free to come to join us. Every condition and the way it is handled. If it is glasses or for that matter refractive error that you have, and depending on the age, you'll tell. Some of them, for children, their vision, the parameters of their vision changes quite rapidly. So some may at least if you prescribe glasses, a maximum of 6 months need a review. But with some to maybe a year. But on average, if it is about refractive error and its correction, we give an average of about 2 years for them. But for children, giving them 2 years is too long a time. So, and depending on the nature of the, the glasses that the child is wearing, will determine what to do. But if the condition is associated with other disease conditions, then that will also determine how often that check has to be done. Because we have diseases that impact on vision. For instance, diabetes, it does impact on vision. Hypertension does impact on vision. Sickle cell disease does impact on vision. And some medications that one is taking. So you cannot just say in one jackpot that come 2 years, 6 months. No. Everything has to be evaluated. And after the evaluation, then determine the frequency that the person has to be seen is done.
I always say the head teacher of Independence Avenue to visit. I realized there were 2 learners in one P4, the other one P5. The teachers complain anytime they are giving work, they take a long time to finish, and sometimes the whole day they will be on one work. So I got them closer, I interviewed them, and I could tell they had a problem with the eyes. Then there's another one in Independence Avenue 1. He has cataract. So one of the officers came around and saw this guy and asked if we can do something about the eye. So I said, oh, well, I'll contact, I know 1 or 2 people, one doctor at 37 and the other one at Kolebu Teaching Hospital. So I'll contact them and see.